In the UK, black women are almost 3 times more likely to die during childbirth than their white counterparts. Just let that sink in for just a moment. And this isn't a gap that can just be explained away with wrong place, wrong time. It's a terrifying statistic that points to a much deeper, more disturbing problem, which everybody with eyeballs can see, but dare not mention through fear or embarrassment. This isn't about some isolated incidents or exceptions to the rule. It's about an illness in the very system that is supposed to heal us, which was a promise made when the NHS was founded in 1948. An illness that, whether we realize it or not, hurts everyone. In the past, I did a video on capitalism killing healthcare. So I guess I'm gonna have to go a bit deeper. When we talk about racism and discrimination in the healthcare system, it's easy to picture a lone doctor that qualified in the late 1980s and still holds those traditional views. A physician that sees nothing wrong with saying coloured or Chinaman. But the truth is, it's much more complicated and dangerous than that. The problem isn't just individual. It's systematic. It's woven into the very fabric of our healthcare institutions, from their policies and practices to their educational foundations, and even the data that powers modern healthcare provision. This isn't a simple story of good versus evil, and I do not care how much you pay for Disney Plus. We do not live in the Marvel Cinematic Universe. This is the story of how deep-seated historical biases have built healthcare systems that deliver shockingly different results for minority communities. And it's about how the systemic failure ultimately chips away at the very well-being of our entire society. Because a system that fails one of us is a system that's failing all of us. To really understand why a black mother faces a greater risk of dying, we have to look beyond the maternity ward and into the past. The roots of this crisis are centuries deep, tangled up in a history where healthcare was used not just to heal, but to justify oppression. During slavery, slave owners only sought health interventions for kidnapped Africans so they could get back to work as soon as possible. Whitechapel was the backdrop where enslaved people took the opportunity to escape after receiving treatment. In the UK, deep-seated distrust has been documented, with many from ethnic minority backgrounds reporting negative interactions, disrespect, and cultural insensitivity. In London, the financial centre of Britain and most diverse city in Europe, 45% of black and 33% of Asian Londoners reported being treated unfairly due to ethnicity. This has created a deep, justifiable and lasting distrust of all societal systems. A 2022 survey found that almost 2/3 of black people in the UK had experienced prejudice from healthcare staff. Just take that in, little piggies. An organisation where over 45% of doctors and 33% of nurses are non-white has the majority of black patients feeling discriminated against. This isn't ancient history, it's a living, breathing wound. But history doesn't just create distrust. History is a place where structures are tested and perfected. In the UK, factors like housing, employment opportunities, and geography have led to people from the global majority being disproportionately affected by socio-economic deprivation, which is the key driver of poor health outcomes. These discriminatory practices produced a powerful domino effect, leading to generations of limited economic opportunities, higher exposure to environmental factors like high air pollution, and the kind of chronic stress that comes from living in a society that constantly puts you at a disadvantage. It's a vicious cycle where social inequality creates poor health, and poor health makes that inequality even worse. So how does this systemic rot actually show up today? Before, we could have accused it of being maybe subtle, almost hiding in plain sight. But now the wolf has taken off the sheep's clothing. First, there's the problem of access and quality of care. Even with a nationalized service like the NHS, people of color often face huge barriers. Waiting times can be longer, and they are less likely to receive swift or correct referrals than white British patients. Countless studies show that black and other ethnic minority patients are less likely to receive the same standard of care as white patients for the exact same conditions. Take pain management for instance. It shouldn't surprise you, but research has shown that many medical students hold the belief that black people have thicker skin or less sensitive nerve endings and therefore feel less pain. And of course this thinking is taken onto hospital wards and inside GP surgeries. Studies indicate that black patients were significantly less likely than white patients to get the most effective types of pain medication after major surgery or for chronic conditions. This isn't just about comfort. Neglecting to treat pain can lead to longer recovery times, chronic pain, and a whole list of other complications. Another study conducted by the Black Equality Organization found that many black women felt practitioners were dismissive of their pain because of the misguided stereotype of the strong black woman. Mary Seacole didn't become a British nurse and a girl boss just so black women could get refused pain medication today. And now, the historical biases are getting a 21st century firmware patch. The algorithm and AI systems designed to make healthcare more efficient are often built on biased data because the humans that gathered the data are biased. Concerns have been raised that inadequate and outdated ethnic data collection standards in the NHS risk creating a misleading picture of health needs, more than likely embedding these inequities into future technology. As we lean more on technology to guide medical decisions, we risk coding systematic biases into the very infrastructure of our future health care, making them harder to see and even harder to fight. And I'm not saying technology is a bad thing because it will be a bloody good thing for white patients. It's easy for some to write these off as problems that only affect certain communities, but that's a dangerously short-sighted view. A healthcare system riddled with inequity is an unhealthy system, and its illness eventually spreads to everyone. First, let's talk about the economic cost. In the UK, it is acknowledged that health inequities lead to excessive and avoidable costs, from lost productivity and direct costs to the NHS. This isn't some made-up number. Despite money being made up, the numbers are real. It's a measure of lost productivity from people dying too young, lost wages from missed work, and extra medical costs that place a burden on the health service. This is a moral failure, but it's also an economic catastrophe that holds our entire country back. And I know it's hard to think about that if World War III happened, but just hear me out for a moment. Second, systematic racism destroys the single most critical ingredient for good healthcare: trust. When huge parts of the population don't trust doctors and hospitals because of past and present discrimination, it's a public health problem for all of us. A 2022 UK report from the NHS Race and Health Observatory revealed alarming levels of discrimination and mistrust, with a third of South Asian participants saying they rarely or never trust primary care to meet their needs. This distrust can lead to things like vaccine hesitancy, delays in seeking care for contagious diseases, and a total breakdown in the patient-provider relationship that is essential for good health outcomes. During a potential future pandemic, that kind of distrust can have deadly consequences for an entire nation. In London, the most deprived, who are most likely to be non-white, have the lowest rates of uptake for breast and bowel cancer screening. Finally, a system that tolerates substandard care for any group lowers the bar for every group. It creates a culture where shortcuts are possible, where listening to patients is optional, and where accountability is weak. The outgoing president of the Royal College of Psychiatrists warned in 2023 that institutional racism is rife in the NHS, harming patients and causing dedicated medical professionals to leave the field, which tracks because black men are 3 times more likely to be detained under the Mental Health Act than white men. When the system allows blatant injustice for some, it poisons the integrity and quality of care for all. The fight for health equity isn't about taking resources from one group and giving it to another. It's about raising the standard of care for the most vulnerable so that every single person gets the best possible treatment. One of the most common ways to dismiss this issue is to say it's just a few prejudiced individuals, a few rogue elements, which is a valid argument when speaking about Harold Shipman. But that argument completely misses the point. You can't fix a fleet by just picking out a few rogue elements. The problem is in the design itself. Institutional racism means the bias is baked into the system. Jesus, I'm finding it hard to keep up with all the different metaphors. It's in the doctor school curriculum that, until recently, rarely taught students how social and historical factors impact health, and sometimes even perpetrated the myth that race is a biological fact. It's in the clinical research trials that have historically excluded people of colour, meaning that the standard treatments and medical dosages are often based on data from white patients alone. It's in the very structure of our institutions. The healthcare workforce, especially in leadership roles, remains disproportionately white. In the NHS, despite ethnic minorities making up over a quarter of the workforce, they hold only 15.6% of board member positions. Furthermore, white applicants are significantly more likely to be appointed from a shortlist than ethnic minority applicants. This isn't about blaming individual doctors, many of whom are working their hearts out under incredible pressure. And I support all strike action taken by healthcare professionals, because get that money, girl. It is about acknowledging that they are working inside a deeply flawed system that pushes them, often unconsciously, towards biased decisions. Real change doesn't come from mandatory online equality and diversity training, although that can help, like wearing sunglasses to look directly into the sun. It comes from fundamentally redesigning the system. And I'm not picking on healthcare workers, because I know the police service in this country is 1,000 times worse, and that shouldn't surprise you because the UK is structurally racist. So what can we do? This problem feels huge, and it is, but it is not hopeless. Real change is possible, and it starts with refusing to look away. Firstly, we have to advocate for systematic change. This means supporting policies that ensure equitable funding and access to healthcare in all communities. It means demanding that medical and nursing schools integrate real, robust, anti-racist and social justice education into their core curriculum. And it means pushing for accountability, so that hospitals and healthcare systems have to track, record, report, and actively work to close racial gaps in their health outcomes. The data is there. Can we start using it to help people? Secondly, on a more personal level, we can work to educate ourselves and others around us. Share this video, talk to your friends and family about this. Look up organizations like the Race Equality Foundation and the NHS Race and Health Observatory, who are doing vital work. There are amazing examples of what's possible when communities and health systems partner directly to reduce disparities. The state of our healthcare system is a mirror reflecting the health of our society, and right now it's telling us we are sick. A system that accepts widely different death rates based on the color of a person's skin is a system that makes Keir Starmer happy. I don't ever want to make that man happy, not even a smile. Fixing it isn't an obscure issue, it's one of the great challenges of our time. Building a truly healthy society means guaranteeing that every single person has the right not just to life, but to a healthy life. And that is the fight that involves and benefits every single one of us. Anyway, like, comment, subscribe, and I will see you in the next one.
My love for you forever, ever and ever and ever. My love for you forever, ever and ever and ever. My